Hello everyone, welcome. I'm Dr. Motahare, and in this session we'll talk about gout, a condition that causes severe, painful arthritis attacks. And many people all around the world are affected. I'll walk you through everything that you need to know about gout. And at the end of the session, you will understand that not only gout is manageable, but it's also preventable. Let's start. What is gout? Gout is an inflammatory arthritis that is caused by deposition of monosodium urate crystals in the joints and also soft tissue, which leads to painful episodes of arthritis, which is known as flares. Importantly, not everyone with high uric acid level develops gout. Even there is a strong relation between high blood uric acid and gout. While high uric acid is essential for developing gout, it's not enough by its own. Many people with high uric acid, which is known as hyperuricemia, never develops gout. Gout actually occurs when high blood uric acid leads to formation of needle-shaped urate crystals, which will be deposited in the joints and triggered inflammation and painful attacks. This inflammation plays a very critical role for developing symptoms and also consequences. About the prevalence, gout is one of the most common forms of inflammatory arthritis. It's more common in men compared to women, and its incidence increases with age. We are also seeing more and more patients with gout because the rate of obesity, diabetes, hypertension, and kidney disease are rising within the communities. What are the risk factors? Being a male, increasing age, family history of gout, a diet rich in uric acid, like lots of red meat, shellfish, sugary drinks, excessive alcohol consumption, especially beers, being overweight or obese, having certain other medical conditions like hypertension, diabetes, kidney disease, heart disease, and also as a side effect of some drugs. The classic presentation of gout is a severe pain in a single joint, usually the big toe. But gout can be affect the ankle, the knee, and also other joints. Some people have multiple joints involvement, and some other has atypical presentation, especially in elderly. Between the flares, patients may have no symptoms, completely symptoms free. But untreated gouts can progress to chronic arthritis with tophi and kidney stones, and also the joint deformities. It means that recurrent attacks without treatment can lead to joint deformation. It is a big problem. Which organs are affected by gout? Gout primarily affects joint, but urate can also deposit in the kidney, leading to kidney stones or chronic kidney disease. Tophi, which are uric acid lumps under the skin, can deform the joints. And we know that gout is linked with cardiovascular disease and metabolic conditions, making it more than just a joint disease. Gout significantly increases the risk of a wide range of cardiovascular disease, including heart attacks, strokes, heart failure, and arrhythmia. The underlying mechanism is believed to be about the chronic inflammation which is caused by uric acid crystals. It means that this chronic inflammation can damage the heart and other organs. This is also, we should also note this matter that after a gout flare-up, this risk is higher compared to between flare-ups. And also, it's higher, this cardiovascular impacts are higher in women and also in younger individuals. So we have a higher risk of cardiovascular disease, especially in flare-up, in women, and in younger age, due to presence of that inflammation. So how we suspect that is a gout flare-up or a gout attack? It causes sudden intense pain, swelling, redness, warmth in a single joint, mostly the big toe. And it often starts at night and peaks within 24 hours. The affected joint may feel very tender and the skin appear red and shiny. The pain can be severe enough to make it difficult to walk or even tolerate bed sheets touching the area, anything touching the area. Over the time, repeated flares can lead to stiffness, puffy, and loss of joint function. After we suspect gout based on clinical presentation and physical exam, for confirmation, the gold standard is joint aspiration for looking for uric crystals under the polarized light microscope. Serum uric acid is helpful but not definitive. It can be normal during a flare. Imaging, including ultrasound or dual energy CT, is increasingly used to detect uric deposits. So, the most common lab test that we order is the uric acid, kidney function test, video and creatinine, markers of inflammations like ESR and CRP, and electrolytes. But remember, uric acid may be misleading during a flare. During an attack of gout, serum uric acid level can be normal, low, or high, which the levels often decrease during a flare and rising again afterward. While elevated levels above 6.8 are characteristic of hyperuricemia and can increase the risk of flare, a specific level cannot be used to definitely diagnose a gout attack. That's why joint fluid analysis is the key. Ultrasound can also show us classic double counter sign of uric acid crystals, and dual energy CT can directly identify uric crystals. For acute flares, first-line treatments include NSAIDs, colchicines, or corticosteroids. Colchicines works best if started early, but it's a special drug because we should avoid overuse. It can lead to different toxicities, and also it should be adjusted based on the kidney and hepatic function. Corticosteroid can be used if NSAID or colchicines are not suitable or the patient is not responding to them. Importantly, if the patient is already on the long-time urate lowering drugs, we do not stop it during a flare. So when there is a flare, we start with drugs like NSAID, colchicines, and corticosteroids. Based on the patient's condition, situation, comorbidities, tolerance, presence or absence of kidney or liver problems, any stomach problems, bleeding disorder. Based on all of these things, we choose one drug to control the flares. And then for chronic treatment, we have other options. Prevention of future gout flares isn't always recommended after the first attack with drugs that lower the serum urics. We should consider treatment for the first attack if the patient has kidney disease, kidney dysfunction, kidney stone, or high level of blood urate. Otherwise, in the normal patients without this condition, we will not advise drugs in this situation, and we will advise them to use lifestyle changes. Most preventive strategies now is just recommended for patients with multiple flares. The goal is to reduce the uric acid level below 6 or even below 5 if there are 2 feet. The first line treatment is allopurinol, but it should be step by step. The key is to treat to target approach. Not just lowering the uric acid level, it's not enough. We should reach and stay below the threshold for crystal formation. So it's a dynamic relationship between patient and doctor. They should work together until they reach to the point that crystals are not formed anymore, and also stay on that stage. When starting uric lowering therapies, patients often get more flares initially. That's why we prescribed other drugs such as low-dose colchicine or NSAIDs for the first 3 to 6 months with the allopurinol. A slow dose titration of uric lowering drugs also helps to minimize the risk of flares. It means that gradually increase the doses of the allopurinol. And also we should advise patients for lifestyle changes to prevent flares, like what? Like to stay hydrated, weight loss, limit alcohol, especially beers. All of these things will help the patients to prevent flares when they are starting uric lowering drugs. The prognosis of gout is very good if it's recognized early and treated properly. Without treatment, gout progresses to chronic arthritis, joint destruction, and kidney damage. And also patients with gout also carry a higher burden of cardiovascular and kidney disease, which can worsen outcome. So the outcome is very good at all if we understand the disease and treat the disease. But if we left it untreated, the consequences are a lot. We can prevent gout by controlling risk factors, maintaining a healthy weight, treating high blood pressure and diabetes, reviewing medication that rise uric acid, regular monitoring of uric acid and kidney function is important. Patient education is very important. Knowing what triggers a flare helps patients stay in control. Patients should limit some foods like what? Like organ meat, such as liver, red meat, certain seafoods like sardines and shellfish, beers, alcohol, sugary drinks, especially those high in fructose. Instead, they should focus on a healthy diet, rich in low-fat dairy, vegetables, and whole grains, and maintain a healthy weight. Okay. Interestingly, poorly rich vegetables like spinach or beans doesn't carry the same risk as meat-based foods. That means that they are safe to eat. To summarize, gout is a crystal arthritis caused by uric acid deposition. Diagnosis is best confirmed by joint aspiration. Acute flares are treated with NSAID, colchicines, or steroids. Long-term management requires urate-lowering therapy with a treat-to-target strategy. Preventive strategies through lifestyle and diet is essential. With proper management, patients can avoid flares and long-term complications. Thank you so much for watching. I hope this presentation has given you a clear guideline-based understanding of gout. Don't forget to subscribe to my channel, The Art of Medicine with Dr. Motahare, for more medical insights. Thank you.